What Can We Do About What We Know?, was authored by Dr. Karen Rhodes from the University of Pennsylvania in Philadelphia, Pennsylvania. Women have a lifetime prevalence rate of 29% for intimate partner violence, with 1 in 7 injured. With a lifetime prevalence rate of 10%, with 1 in 25 injured, men are less likely than women to experience physical or sexual intimate partner violence. Victims of intimate partner violence experience high rates of adverse physical, social, emotional, and mental health outcomes. The evidence supporting routine screening for intimate partner violence, the feasibility of such screening, and the political will to address violence and related risk factors are rapidly evolving. Innovations in health information technology and changes in the organization and delivery of healthcare have the potential to provide the system-level support needed to make routine screening for intimate partner violence a reality. The commentary entitled 10 Recommendations for Closing the Credibility Gap in Reporting Industry-Sponsored Clinical Research, a joint journal and pharmaceutical industry perspective, was authored by Bernadette Mancy and colleagues from several pharmaceutical companies, including GlaxoSmithKline, Amgen, Novartis, Johnson & Johnson Pharmaceutical Research, and AstraZeneca, and from the following journals: Journal of Clinical Oncology, Annals of Internal Medicine, and The Lancet. Leerink Swan Consulting and the International Society for Medical Publication Professionals also took part in the writing of this manuscript. These recommendations are meant to enhance the transparency and credibility of industry-sponsored clinical research. According to the authors, sponsors should continue to promote best practice guidelines and work with other biopharmaceutical and medical device companies and professional organizations to ensure uniform adoption. Editors should ensure that their policies for publication are clear, transparent, well-publicized, and uniformly applied, irrespective of author affiliation or study sponsorship. The authors identified several areas of potential collaboration between journals and sponsors, including educational activities such as the guidelines given in the current manuscript, or education for authors of industry-sponsored research. Journals and industry sponsors should also jointly discuss areas of persistent ambiguity and extend their efforts toward raising the standards for all research activities, industry-sponsored or not. A video interview with one of the authors can be viewed on the homepage of Mayo Clinic Proceedings. The original article entitled Computer Activities, Physical Exercise, Aging and Mild Cognitive Impairment, a Population-Based Study, was authored by Dr. Jonas Geda and colleagues from the Mayo Clinic campuses in Rochester, Minnesota and Scottsdale, Arizona, and from the University of Wisconsin in Madison. The authors interviewed a random sample of 926 individuals aged 70 to 93 years without known dementia. All study subjects had completed a questionnaire on physical exercise, computer use, and caloric intake within 1 year prior to the interview. The authors classified each study participant as being cognitively normal or having mild cognitive impairment. The authors found that both physical exercise and computer use, as self-reported by patients, was associated with decreased odds of having mild cognitive impairment after adjustment for caloric intake and traditional confounders. A video interview with Dr. Geda can be viewed on the homepage of Mayo Clinic Proceedings. The review article entitled Common Musculoskeletal Tumors of Childhood and Adolescence was authored by Dr. Carola Arndt and colleagues from Mayo Clinic in Rochester, Minnesota. Based on a literature review that included articles since the year 2000, the authors reviewed the diagnosis, prognosis, staging, multidisciplinary therapy, new directions in therapy, and long-term complications of treatment for osteosarcoma, Ewing sarcoma, and rhabdomyosarcoma. They point out which factors have contributed to the improved outcome for these patients over the past several decades, and which future developments hold promise to decrease the risk of late adverse effects from aggressive treatment. A video interview with Dr. Arndt can be viewed on the homepage of Mayo Clinic Proceedings. Again, please be reminded that authors or co-authors of 4 of the articles we have discussed, including Drs. Gerber, Levy, and Arndt, have provided video interviews. These interviews are available on the new homepage of Mayo Clinic Proceedings at www.mayoclinicproceedings.org in the upper right-hand corner. These author videos are now hosted on YouTube and will play noticeably faster for you than they did until recently. On our homepage you will also find additional content that is not available in the print journal, such as extra residence clinics articles, medical images, stamp vignettes, and other materials. Dr. William Lanier, Editor-in-Chief of Mayo Clinic Proceedings, the entire editorial board, and I sincerely hope that you will enjoy these and the other outstanding articles in the May 2012 issue of our journal. We do thank you for your interest in and continued loyalty to Mayo Clinic Proceedings, and we are grateful for your ongoing support of our journal's mission to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. Once again, please share with us any suggestions you might have for improving the quality of our print journal and website and of our services. The June 2012 issue of Mayo Clinic Proceedings will be published online on Friday, June 1st, 2012. Please check back on that date to hear the multimedia summary of highlights from that issue.
We hope you benefited from this presentation based on the content of Mayo Clinic Proceedings. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you're interested in more information about Mayo Clinic Proceedings, visit our website at www.mayoclinicproceedings.org. There you will find additional videos on our YouTube channel, and you can follow us on Twitter. For more information on healthcare at Mayo Clinic, please visit www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.